Hi everyone, welcome back to my YouTube channel, and today we are going to talk about external carotid artery. So let's start our topic with introduction. External carotid artery is major arterial vessel of head and neck. It is one of the two terminal branches of common carotid artery, the other being the internal carotid artery. Unlike the internal carotid artery, which supplies intracranial structures, external carotid artery primarily supplies the face, scalp, neck, tongue, thyroid gland, and other extracranial structures. Understanding its branches and distribution is crucial in surgical procedures, trauma management, and diagnosis of vascular diseases. Origin of external carotid artery. External carotid artery arises from the common carotid artery bifurcation at the level of upper border of thyroid cartilage around the intervertebral disc between C3 and C4 vertebra. Course of external carotid artery. First, there is cervical course. It starts when artery begins at the carotid bifurcation and ascends anterior medial to internal carotid artery in the neck. Position. Initially, external carotid artery is medial to internal carotid artery, then crosses over and becomes lateral to the level of mandible. Then it passes deep to posterior belly of digastric and stylohyoid muscle and continue upward behind the neck of mandible. Termination of external carotid artery. It terminates within the parotid gland behind the neck of the mandible by dividing into two terminal branches that include superficial temporal artery and maxillary artery. Relations of external carotid artery. Anteriorly to the external carotid artery, there is skin, platysma, fascia, and anterior branches of external carotid artery. Posterior to it are the internal carotid artery, vagus nerve, and superior laryngeal nerve. Medial to this artery are pharynx, superior laryngeal nerve, external and internal carotid nerves. And lateral to this artery are internal jugular vein, sternocleidomastoid, and hypoglossal nerve. Branches of external carotid artery. External carotid artery has 8 main branches that are grouped as anterior, posterior, medial, and terminal branches. First, we will talk about anterior branches. Anterior branches include superior thyroid artery, lingual artery, and facial artery. Superior thyroid artery supplies thyroid gland, larynx, infrahyoid muscle. Lingual artery supplies tongue and floor of mouth. Facial artery supply face, tonsils, and submandibular gland. Then there are posterior branches of external carotid artery that include occipital artery that supplies scalp over occiput and posterior neck muscles. Then there is posterior auricular artery that supplies auricle and scalp behind the ear. Then there are medial branches of external carotid artery that include ascending pharyngeal artery that supply pharynx and prevertebral muscles and meninges. Then there are terminal branches of external carotid artery that include superficial temporal artery and maxillary artery. Superficial temporal artery supplies scalp and lateral face, while maxillary arteries supply maxilla, mandible, teeth, muscles of mastication, and nasal cavity. Distribution of external carotid artery. External carotid artery is responsible for supplying most of the extracranial structures of head and neck. They include face, scalp and auricle, tongue, oral cavity, tonsils and pharynx, thyroid gland and larynx, and also parotid gland, maxilla, mandible, and teeth. Development of external carotid artery. External carotid artery develops primarily from the ventral aorta and the first 3 aortic arches. The complexity of its branching pattern reflects embryological development of head and neck structures. Clinical significance of external carotid artery. First is carotid artery ligation, that is ligation of external carotid artery that may be performed to control bleeding in severe trauma. Second is scalp and facial laceration, as external carotid artery branches are important in managing scalp and facial bleeding due to rich vascularity. Third significance is aneurysms, as dilation of external carotid artery or its branches can cause localized swelling or pain. Fourth is an arteriectomy, though less common than internal carotid artery and arteriectomy. External carotid artery disease management is clinically significant. Fifth is surgical landmark, as surgeons use external carotid artery branches as landmark for head and neck surgeries. Conclusion of this lecture video. External carotid artery is a crucial artery that provides extensive blood supply to face, scalp, thyroid gland, tongue, and neck structures. Its numerous branches and rich anastomosis make it significant in both anatomy and clinical practice. A thorough understanding of its course and relation is essential for safe surgical intervention in the head and neck region. And this was all about external carotid artery. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.